Good day and great health. My name is Dr. Jericho Sarko of Ohio Specific Chiropractic. I'm a pediatric, family wellness, and upper cervical specific chiropractor. Today in this video, we're going to talk about the connection between the condition trigeminal neuralgia and the upper cervical spine. A disclaimer at the start: as a chiropractor, my goal is not to treat any specific condition, sickness, or disease directly, but to help remove a major roadblock to your overall health and well-being. That major roadblock is a vertebral subluxation. A vertebral subluxation can disrupt the overall functional capability of your nerve system, thus decreasing your potential for health and well-being. So in order to dive into the connection, we will do a simple crash course in anatomy and physiology. In the upper cervical spine, we focus on four main structures. We have the occipital bone found on the lower portion of our skull. We have the atlas bone, or the first cervical vertebra. Next down we have the axis bone, or the second cervical vertebra. Now, housed and protected in these three bones, we're going to find the most delicate and important tissue we have in our body, our nerve system. And specifically housed and protected in the upper cervical spine, we will find the brainstem area of our central nerve system. Now, along with those four main structures, we'll just focus on one nerve, but it is a very special and unique nerve. That is the trigeminal nerve. We have what's unique about the trigeminal nerve. Tri means three. There's going to be three major branches of that nerve. We have the ophthalmic, maxillary, and the mandibular. The ophthalmic branch supplies functional information to our eyeball, face, scalp, nasal cavity, and skull. The maxillary branch supplies functional information to our upper jaw, nasal cavity, sinuses, and the roof of our mouth. And finally, the mandibular branch supplies functional information to the chewing muscles, the cheek, tongue, lower jaw, throat, and part of the ear. Now, all the nerves of our body, not just the trigeminal nerve, serve four main jobs or functions. They are movement, sensation, regulation, and relation. They control all the movements we make. They sense everything we feel, they regulate all our body organs, and they relate us to the outside world. Now, nerves can get stressed. There are three major types of stresses that affect the functional capability of those nerves. They are physical, chemical, and emotional in nature. These stresses put added tension on the nerve and can create an imbalance in the body. They also then negatively affect the overall sensitivity, perception, and behavior of the nerves. Now, one of the jobs of our brainstem is to adapt these stresses and bring the body back into balance and to ease the tension off the nerves. But as we are being constantly bombarded by physical, chemical, and emotional stresses on a daily basis, our brainstem can't always adapt to them at its best. If the brainstem cannot adapt to the stress as best it can, it's going to create an abnormal compensation. One specific and major abnormal compensation that we deal with as chiropractors is a vertebral subluxation. In our schematic drawing here in the middle, I drew a simple example of how when the atlas bone shifts out of place and creates tension on the nerve, it's going to disrupt and put added irritation and inflammation into the nerve we're going to focus in on, is the trigeminal nerve. So a vertebral subluxation is going to then create an abnormal sensation, perception, and behavior in the nerves involved. Now, if we focus just on the trigeminal neuralgia, we can see that over time these abnormal sensations, perceptions, and behaviors can create symptoms. Now, what is some of the major symptoms associated with trigeminal neuralgia? The biggest one is going to be a very severe electric shooting, shocking pain that can happen in the face and jaw. The pain can be so severe that it's often called the suicide pain because the pain itself is so excruciating. Along with the suicide pain, sufferers of trigeminal neuralgia can have just a constant ache or burning sensation in the jaw, teeth, gums, eyes, face, and ear. Now, if we look to these symptoms, we can see they are directly correlated and associated with these three branches of the trigeminal nerve. Now, what is the usual medical route or intervention? Usually some type of drug and or some type of surgery. Usually the first round of drugs is going to be some type of muscle relaxant. After those, sometimes work, sometimes don't, but a lot of times they do only work temporarily. So after that first round, usually bumps up or upgrades to a anti-seizure medication or drug. Those again can work or can't, but if they do work, they usually only work temporarily. After that, usually then bumps up to some type of injection, usually a Botox injection. Those can then work, but usually only work temporarily. After that, you bump up to even more aggressive surgeries. Usually a surgery that will involve either trying to cut the blood supply to the nerve, either then doses of radiation into the nerve, or finally some type of surgery to sever the nerve itself. All these different drugs and surgeries are an attempt to try to desensitize the feeling or sensation of the nerve. Now, what is the chiropractic approach? Well, in chiropractic, our goal is not to try to desensitize any nerve, but to actually help try to normalize nerve sensation. We do that by locating a vertebral subluxation because vertebral subluxations create abnormal sensation, perception, and behaviors. So by removing that major disruption to our neurological system, we can see a major decrease in abnormal compensations and a decrease in the stress on the nerves, so then our nerve system, especially our brainstem, can function at a higher capability and functionality. Now, this is just a quick primer into the connection between trigeminal neuralgia and the upper cervical spine. But if you have any more questions or concerns, please don't hesitate to reach out to me on my website at ohiospecific.com. Thank you very much.